Well, as we have been reporting, there has been a lot of criticism of these latest restrictions, including from some health experts who question why many outdoor activities are now being banned again. Dr. Monica Gandhi is an infectious disease specialist at UCSF, and she tweeted her concerns, saying that there is no evidence to support shutting down things like playgrounds and outdoor dining or stopping people from gathering outside. Again, she said the decisions are not data-driven. She goes on to say that we know a lot more about the virus now than we did back in March, and that limits like these will, quote, erode trust in public health officials and foster non-compliance with such orders. And joining us this afternoon is Dr. Gandhi. Thank you so much for being here. If you could explain a little bit more about why you believe some of these actions are unnecessary.
You know, my concern is not because I don't think cases are increasing. They're definitely increasing. Our hospitalizations are increasing, though luckily we still have the ICU capacity and the other metrics set forth by the state. I'm concerned if we lock down or close down outside activities that we could drive people inside. And because we've learned so much more about this virus, like ventilation, like playgrounds being safe. And if we put things into play that seem arbitrary to the public, they may violate them by going inside. And so I think we have to be as data-driven as possible when we make recommendations, which is what San Mateo and Sonoma and Napa chose to do. They chose to go by the state guidelines and not be preemptive.
Okay, so doctor, let's take this one by one if we can. Let's first talk about playgrounds and what we have learned about surface transmission. And again, why you believe playgrounds are indeed a safe place for children and others to go outdoors.
Yes, so, you know, at the beginning of the pandemic, we had no idea what was going on. It was just the right thing to close everything down. It was just terrifying. Were we getting it from surfaces? Were we getting it from fomites? Was it radioactive? Was it, what was happening? And really, it really is the spread from the nose and mouth, even when you feel well, asymptomatic transmission, that leads to the spread of a respiratory virus. There hasn't been over 9 months good evidence that we get it from surfaces. You need you need 100 people to sneeze on one surface and then everyone go and wipe themselves with that surface to get it that way. We've had a lot of data sets. So luckily, outdoor spaces, because of the ventilation and lack of surface transmission, are safe. And the thing about playgrounds is it's the inequity issue in our cities. We have people who have backyards who are privileged enough to have that. And then we have inequity where a lot of people, where their children are cooped up, they play on playground structures. So I think it's that risk versus benefit analysis that outdoor playgrounds don't have data behind them that they spread COVID-19.
Okay, so you say playgrounds are indeed safe in your opinion, and that's what the data shows. And also
Yes.
you say outdoor dining. You say that there is no data, absolutely none, to show that this in fact is unsafe.
So it depends on the outdoor dining, but if you have ventilation, masks, distancing, and hand hygiene, and surface decontamination, which a lot of people went through a lot of trouble to do, then we don't see, there hasn't been a good study that has shown us that outdoor dining drove this. So then the question is, what's driving this? I actually think it was people gathering more indoors, or people gathering in larger groups and taking off their masks. So if we are going to close outdoor dining, I would recommend that we give people an end date and money, to support their workers until then. I do understand that it may indicate another behavior, that you gather indoors more. So maybe that was the thinking, but it's not clearly data driven.
Okay, so when you look at just those two aspects, what do you believe is the reasoning for including, let's say, playgrounds and outdoor dining in these bans?
I think it's because, understandably, we're fearful of the cases going up, and we have 117 hospitalizations in the city of San Francisco. So you have a number, and you want to just sort of keep people from doing anything together, and so you shut down everything. And then the idea is that people kind of meet you 70% of the way. And so it could be that that's the reasoning behind it. I think 9 months, though, into the pandemic, enough people know about the safety of outside and they have been doing kind of all the right things, which is meeting with mask distancing, hand hygiene, and ventilation, that we shouldn't put restrictions around things where it doesn't make sense, and then just put restrictions around where it does make sense, which is indoor and without masking. So it's the public knows too much, I think, because we've all learned so much about this virus, and you as the press are telling us a lot about the virus.
And so finally, Doctor, your argument is that since people have a lot of knowledge and we have learned so much since the beginning of this pandemic, that these restrictions, in your words, may actually backfire.
Yes, my argument is that let's use more precise and sharp instruments when we make decisions instead of blunt instruments like we had to do in March. So make decisions based on what you know about contact tracing, what you know about the virus, and by being more nuanced in decision making. San Mateo put out some recommendations about 2 households coming together, being outside, not dining. By being more nuanced about that, the public may buy in more, and then we'll have more compliance, because Thanksgiving, people flew despite the CDC saying not to travel. So we want to do everything we can to get buy-in.
All right, Dr. Monica Gandhi, really appreciate it. Infectious disease specialist there at UCSF. Thanks again.
Thank you.